Hey, good evening, friends. Today we are going to discuss another case note. This is a case note of Mr. Pattinson. You are the staff nurse taking care of Mr. Pattinson, who underwent right knee below amputation in 2006 following an accident. He is ready to be discharged from hospital tomorrow. So that is the information which you have given. So the name is Mr. Robert Pattinson, age 64 years. Then the social and medical background is given. Widower, lives alone. Aged petitioner. Home nurse visit daily for assistance in activities of daily living. Socially isolated. Only a few friends. That means no friends. Chronic smoker since 30 years. Weight is 75 kg. Then the medical history is given. Dementia in 2010. Right knee below amputation in 2006 due to accident which resulted in impaired mobility. Hypercholesterolemia, bronchial asthma in 2009. The medications are metered-dose inhaler, that is the abbreviation is MTI. Salbutamol 200 microgram as required. MDI budesonide 400 mg twice daily. Theophylline sustained release tablet 250 mg once daily. And lovastatin tablet 20 mg once daily. The admission date is given on 9/9/2020. Then the complaints are cough with sputum, pain when inhaling air at chest, breathlessness, unable to speak in full sentence since 2 days. Then the blood test, white blood cell and erythrosedimentation is high. HbA1c, adequate control of blood glucose. Then the assessment, alert, no pedal edema. Then the BP 126/75, heart rate is 78, respiratory rate is 28, saturation is 93% on room air. Then what is the diagnosis? Acute exacerbation of bronchial asthma secondary to upper respiratory tract infection. Then what are the management given? Intravenous hydrocortisone 100 mg 3 times daily. Intravenous augmentin 1.2 gram 3 times daily. Nebulizer Ventolin every 2 hours. Oxygen 2 liter per minute. Continue saturation monitoring. Then on 12 September 2020, patient's blood pressure is normal, respiratory rate is normal and saturation is 98%. That means the patient's condition has improved. Now he doesn't have any problem. But there is cough, still he experienced cough with yellow sputum. Sputum culture was done, no pathogen isolated. On 14th, what happened? He developed fever, cough with yellow sputum and difficulty in breathing. No new action was taken. On 17/9, no more fever but still had cough with yellow sputum. 18th, still had cough. The sputum turned white. Antibiotic stop. Ready to be discharged tomorrow. So the discharge date is 19/9. Then what are the plans? Counsel patient to avoid allergen that may trigger attack and avoid non-steroidal anti-inflammatory drugs. Continue medications. Follow up with the respiratory therapist every Monday. Assistance in activities in daily living. Improve the mobility. Consider physiotherapy, mainly the chest physio because he has a lot of secretions. Then saturation monitoring at home. Oxygen 2 liter if needed. Then what is the writing task? To whom we are going to write? Using the information in the case notes, write a transfer letter to Miss Jennifer Atkinson, staff nurse, Wellmount Nursing Care Agency, who provides care to the patient for the last 1 month. So what do you understand from this case note? In the writing task is clear. The nurse to whom we are going to write this letter, she is taking care of this patient for the last 1 month. That means it is a known case. So we don't want to write any social history or past medical history. She knows what's happening. So we got the reader's name and this is a transfer letter to their facility. Okay. So the patient just admitted with these complaints and now his condition has improved. So he is going back there. So this is a known case. The admission date is here. So we don't want to inform any personal or social or medical history. And this is a tricky way what they are used in the initial phase. You are the staff nurse taking care of Mr. Pattinson who underwent right knee pillow amputation in 2006 following an accident. So it can be confused. Some people might think this is the diagnosis. But we have to observe the date. The year is mentioned in 2006. But now the admission date is 2020. So this is just a past medical history. And he is ready to be discharged from hospital tomorrow. So if we didn't analyze the case note properly, there is a great chance to make mistake. We can write it as a diagnosis and he is ready for discharge tomorrow. So always be careful and make a clear plan before starting writing. So let's see how we can write and what all information we can include. So the reader's name first, the address, Miss Jennifer Atkinson, staff nurse, Wellmount Nursing Care Agency. The date is what we have to write here. The date should written 18/9/2020 because the discharge will be tomorrow. So we are writing earlier. Then dear Miss Atkinson, regarding Mr. Robert Pattinson, what is his age? Age 64. Then as it is a known case, we can just write updating. I am writing to update the current health status of Mr. Pattinson, who even we can write Robert Pattinson in the introduction, there is no problem, who has been diagnosed with acute exacerbation of bronchial asthma secondary to upper respiratory tract infection. What is his requirement? He requires your continued care or ongoing care and management following his discharge tomorrow. That should be mentioned. Then what we can, even though it's a known case and if we didn't write the complaints in detail, the word count can be less. So we can just elaborate and write, but be careful. Don't include the irrelevant informations. So upon admission, Mr. Pattinson had cough with yellow sputum, breathlessness and chest pain, which was associated with the inhalation. Therefore, 2 liters of oxygen and Penrolin nebulizer every 2 hours were administered for him. His SpO2 has been observed continuously. A blood test was performed. It's all mentioned here. A blood test was performed which revealed an elevated white blood cell and erythrocyte sedimentation rate, for which he was commenced on intravenous augmentin 1.2 gram and hydrocortisone 100 mg thrice daily. So until this part we have written. Then on subsequent days, no need to write one by one. We can just write all together, just concise. On subsequent days, what happened? He had persistent symptoms because these symptoms are almost same. That is why we can write persistent symptoms along with fever. This is the new findings there. He has fever now. His sputum culture was unremarkable. So at least they may get the awareness. As a result, no new action was taken because it was negative. Currently, his condition has improved as evidenced by no more fever and white sputum. It's already turned white now. However, he still has cough. That we have to mention. Then what are the recommendations, the plan, what we will write? In view of the above, it would be appreciated if you could advise him to avoid allergen that may trigger attack as well as non-steroidal anti-inflammatory drugs. So be careful when you are writing the spelling of advise. This is a verb. So what you have to write? A-D-V-I-S-E. So advise him. Then please pursue his medications. Just continue his medication. He requires support in daily living activities. And consider physiotherapy, including just physiotherapy we can write, or even we can mention separately, to improve his mobility. It is important to track his saturation at home. We can use the synonyms to avoid the repetition. And kindly administer 2 liters of oxygen if needed or if required. Of note, he has a review with the respiratory therapist every Monday. Then the conclusion sentence we can write. Please do not hesitate to contact me if you have queries. Yours sincerely, staff nurse. I think it's clear for you, and if you require more clarification, you can just comment below the comment box. Thank you.